welcome you this morning for the press statement on behalf of the Embu County government following the doctor strike that started at midnight last night. And let me begin by mentioning that the Kenya Medical Practitioners and Pharmacists and Dentists Union, KMPDU, issued a strike notice on 21st of December 2023. Their grievances that they put forth were as follows. Number one, delayed and denied promotions, shortage of doctors, conversions of doctors under contract terms to permanent and pensionable terms. Number four, non-remittance of statutory deductions and contributions. Number five, non-release of doctors for study leave. Number six, unfavorable working conditions for doctors. Number seven, unprocedural stoppage of salaries, victimization and arbitrary transfers. Number eight, implementation of the 27-2021 CBA. However, the Embu County government has been keen on ensuring that the health sector is brought back to its feet from where we found it. We are way much better than we were when we took over, and this can be evidenced by the increased number of patients seeking health services at our facilities. Currently, we attend to approximately 1,600 visits per day at Embu Level 5 Hospital, and about 350 from around 350 patients per day that was happening last year at the time when we took over government. So I wish to respond to the issues as follows. Issue number one, delayed and denied promotions. One doctor under common cadre was promoted in this financial year, and the delay in placing specialists has been occasioned by low budgetary allocations. The pending promotions stand at 400 million, and this is a very high figure to take up at a go. The union is aware that the pending promotions will be factored in gradually in subsequent budgets. I wish to say that this particular demand that is affecting 97 doctors is way beyond our ability. I have been very, very honest with the doctors. We don't have that kind of money at the moment. We have come in at a time when there was serious high pending bill of 2.2 billion, of which about 578 million was for staff remittances and deductions. So for us to be able to promote these doctors at once will be totally impossible. We don't have the money. We cannot even promise we can do it even in the next financial year, but we are asking them to give us time so that as we improve even on our own source revenue, because there is no additional revenue from the national government to the county, then we can consider promoting them gradually as we move along. Otherwise, we are completely unable to do that at the moment. There has been a serious problem of shortage of doctors, as they have mentioned, and we were able to recruit 4 additional medical officers from the savings out of the exits of other medical staff, maybe by retirement or natural attrition in the last year. And we have another 6 medical doctors expected to be recruited within this quarter, and 4 additional medical specialists are expected to resume duty after completion of studies that they finished in December 2023. So yes, we are doing something about it, but because again of shortage of money, we are not able to bring them on P&P. We are employing them on contract so that we are able to get more out of the little savings that we are having. Then there was a demand of conversion of doctors under contract terms to permanent and pensionable terms, and I wish to state the following. As a county, we have taken a stand to engage our staff on contractual basis for more efficiency in service delivery and for affordability purposes. You can see that in the first quarter, we were able to employ 74 nurses on contract, And if we had gone on P&P, we'd probably have employed about 30. And that has greatly improved service delivery and reduced the workload of the existing nurses. And they're extremely happy, as we have also had them talk to us this morning. So we will continue to do that, but on contract basis, because we are the ones who know how our resource basket looks like. To push us that we must employ everybody on P&P is to push us to a direction we cannot afford. And so to be able to meet the gap, the shortage of staff, we have to go on contract basis. Then there's the non-remittance of statutory deductions and contributions. The government has made great progress and is in the process of clearing third-party deduction arrears accumulated from the previous administration. At the time I took over government, we inherited 578 million in pending and remitted statutory deductions. This financial year, we've been able to clear 300 million, and we have outstanding arrears for the medical, the outstanding arrears for the medical doctors currently are for September and October only, and we'll be able to clear that. Since I took over, we have ensured that we have remitted all statutory deductions without fail, because we do not want to add on to the problem of pending bills for our staff. And I want to say we are committed to that, and that's something we want to be able to clear within the next financial year, so that we start on a clean slate. And the MCAs have been very supportive in that. They actually supported the 300 million that we were able to pay this financial year. So that's where we are on statutory deductions and contributions. Then there's an release for doctors for study leave. In a cabinet meeting of 27th February 2023, we noted that we had 22 doctors on study leave, and this was highly affecting service delivery. And I think it's important to point that when doctors go on study leave, they don't go for a year or two. They normally go for anything between 3 years to 5 years. So when you have 22 going all at once, it dents service delivery in a very big way. And so we agreed that at no time should we have more than 10% of the staff going out on study leave, and so that we do not affect service delivery. And so we decided to pay any further study leaves until we have a sufficient number of the 22 come back, and then we can begin to release others to go out. And that is our position as of today. And we hope that we are able to sort that. As at today, 9 doctors are on study leave, and so we'll be able to start to release others to go on study leave once we are satisfied with the numbers that are there and working. And it's also important to note that this particular financial year, we've only had one eligible medical officer who requested for study leave, and this case is being addressed accordingly. Then there was the issue of unfavorable staff working conditions for doctors. There was the issue of improving commodity supplies, recruitment and recruitment of additional staff. As you have seen, we are working very hard to make sure we have steady supply of commodities or medical supplies for that matter. And recruitment of additional staff, I have mentioned we have recruited 74 nurses, we have recruited lab technologists, we have recruited mortuary attendants, we have recruited the doctors, MOHs, 4 of them, and we are adding 6 more, and we are also adding more nurses this quarter. So we are hoping that in total, just to be clear, we've done 4 doctors, 74 nurses, 8 clinical officers, 10 lab technicians, 2 radiographers, 3 pharmacists, and 3 morgue attendants. So in terms of a human resource, we are working towards ensuring that we have adequate staff to be able to give sufficient services to the people of Embu County. And then also a restroom for doctors at level 5 hospital has been renovated and fully equipped and is ready for use. So before, the doctors did not have a rest room, so that if you're on call or you are taking a break in between your route, you didn't have anywhere you could sit. But we renovated a room and it is ready for use. And then we have been able to have to repair 2 extra ambulances that have been repaired and are in use as we speak. And then a service contract for essential equipment. And this, I think I need to explain. We had the MRI, CT scan, renal equipment that were mainly supplied under the program called the Medical Equipment Scheme through the national government. Now, abruptly, in the last month, the national government discontinued their service contracts with the vendors of these machines. As a result, we found ourselves with machines that are not working. Currently, our CT scan is not working, our MRI is not working. They were not our property, they were the property of the national government. In December, during our summit with the president, that matter was discussed. The president agreed to continue with the service contract up to March to allow for county governments to prepare themselves in terms of budgets for servicing of their equipment going forward. But that change didn't happen immediately. So what we are doing as a county government, we have managed to get a vendor who is coming in today to do servicing for our CT scan. But the MRI will have to wait a bit longer because it needs more work and we need to get authority by the vendor to use it. So that is where we are. But we are really keen on making sure the CT scan is up and running as we go. But our x-rays are going on. We are able to do all the other imaging services as we await the servicing of the CT scan and MRI. So we beg the people of Embu County to be patient with us as we try to sort this. Then there was the issue of procedural stoppage of salaries, victimization, and arbitrary transfers. The county has not victimized or made any arbitrary transfers, nor stopped salaries and procedurally. However, administrative action is or can be taken against an individual when necessary and in accordance with the existing service regulations. Transfers are always carried out on a need-to-need basis. We say that once you have come to work for Embu County, you should be ready to work anywhere in the county. There was over-concentration of certain medics in the level 5 hospital and denying the peripheral hospitals the much needed service. So we had to transfer some of the medics from here to the peripheral hospitals, the level 4 hospitals, so that we can be able to enhance service delivery. Now they have a problem with that, and I think that's a conversation we should have. We also had some doctors who had gone on study leave. According to the letter, they had been given maybe 3 years study leave. 3 years have passed. They have not yet reported. They are still receiving salaries. We communicated to them. They did not communicate back. So we stopped their salaries. Now once we stopped their salaries, wakaamuka, and they found their way back. So we had to do that so that they can realize we are serious with what we are doing. We will not pay people if they are not working for us. It's that simple.
Yes.
It's that simple. So the implementation of the CBA 2017-2021, the county secretary constituted a CBA implementation committee back in August 2023, and the union was required to nominate their membership to facilitate the implementation. Upon advice from the Council of Governors in December 2023, the 2 teams are now expected to sit and review the CBA. In the foregoing and occasioned by the strike, we have taken measures to ensure that service delivery is not adversely affected and that will continue to offer services in all our facilities as has been the case. So we have taken certain measures, and they include the following. We have engaged medical officers on locum basis. We are going to be engaging 15 medical officers in Embu Level 5 Hospital and 6 for our Level 4 facilities, totaling to 21 medical officers to be able to continue with the services as we await our negotiations with the doctors who have gone on strike. We are also going to use the existing doctors who are on contract because they are not unionizable, so they cannot go on strike. And I want to urge those doctors that are on strike and they know they are on contract, please come back, because you know you're not supposed to go on strike when you're on contract. come back so that we do not take any further administrative measures on you. We have 10 doctors on contract terms, so we hope that they'll continue to work. Then we have also engaged all our registered clinical officers on locum basis from outside the county and from our neighboring counties. And we have brought 5 for level 5 hospital, 2 each for Kianjokoma, Runyenjes, Ishara, Chicago, and Kiretire facilities. So services continue. Then we also engaging health promotion officers, HPOs, as nurses. We have 7 health promotion officers who have now been redesigned from the nurses cadre and put as health promotion officers. They have been deployed to perform nursing duties during the period of the strike. The other nurses may be redistributed where necessary. We are also recalling all healthcare workers who are on leave, because during these extraordinary times, we must now get everybody back to work. So we have written to all the healthcare workers who are on leave and asked them to report back to work immediately so that we can reduce the workload. And then we have also beefed up security in all our hospitals so as to protect the staff who will continue working during the strike period. So we are hoping that the doctors will not start getting intimidating those that want to continue working or wanting to paralyze the services in the hospitals. So we are working very closely with the security docket through the county commissioner to ensure that there's security in all our hospitals. In conclusion, I want to assure the people of Embu County that our services are ongoing. We even have surgeons for emergency cases here at level 5 hospital, so that if we have mothers who need cesarean or other emergency surgery cases, they are able to be taken care of. We've gone around the entire hospital. Services are going on as usual. And so we urge the people of Embu County, please don't panic, come to the hospitals, you'll be taken care of. And I want to assure the people of Embu County that myself, the government, the entire leadership of the county assembly, the members of the county assembly, we will not tire to continue being in these hospitals every day until everything gets back to normal. We will not run away from this challenge. We are going to face it head on. We are asking the doctors to reconsider their stand. My doors are open. I'm ready to meet them, but I'm asking them to come to me, not with set minds, but to come to me with open minds so that we can be able to deal with what is possible, and what is impossible, we agree how to make it happen in the medium to long term. Otherwise, thank you very much. Asanteni sana.